Alright, so I'm doing my speech on medical error in the U.S. Does anyone know what the leading cause of death in the U.S. is?
No.
Heart disease, cancer, and medical error. You know how many people die each year to medical error?
A lot.
A lot. 250,000 people a year die to medical error. It's very strange how you can go somewhere for medical help and you'll end up dying. So according to a research study published by the April 26th issue of the Archives of Internal Medicine, Laurie, Barclay, and Desiree stated that they conducted research on 98 nurses in the administering process and preparation process of medication over 4,000 times with 700 patients. That was at 2 hospitals, and interruptions during the administration of medicine happened 53% of the time. And the nurses failed to follow proper procedure in preparing medicine nearly 3/4 of the time, and how the drug is to be administered 1/4 of the time. So what does that mean? 53% of the time, nurses were stopped when they were doing something for you. If they were going to get a drug, they were stopped. 75% of the time, the meds were not correctly prepared, so if something needed to be chilled or heated, they didn't do it. And 25% of the time, they gave the meds the wrong way. So if something where you're supposed to take by a breathalyzer thing, or by mouth, or any other way, they didn't do it right. When you see a nurse getting stopped when they're getting your medicine ready for you, you have 2 times more likely to get seriously injured. So, interruptions are a problem in the nursing field. And the PSN Net's article, Medication Administration Error, they found that 25% of 91 nurses had timing errors, which means they were supposed to give the drug at a specific time and they did not. So if at 8 a.m., they got it at 9 a.m. They also found that when interrupted administering intravenously, they would be incorrect 50% of the time. So that means if you're getting something through the veins and you interrupted them, 50% of the time they didn't do it right. Has anyone ever had a medical error happen to them?
The doctor looked at the wrong side of my mouth.
Yes, that's a minor one. So I've seen a doctor, or when I was in clinicals, I've seen a doctor order 2.5 liters of medicine when it's supposed to be 2.5 milliliters, which is kind of a lot.
Big oops.
Another thing is the amount of patients nurses have. According to Lipton Scott's article, Simple Steps to Prevent Medical Error, the author Chu Ruby found that out of 202 nurses, 158 claimed they had a medication error, and 25% believe this was from having too many patients. So the next main point is the medication itself. Medications can be identified in many ways, such as Advil. Advil has a class of NSAIDs, a general of ibuprofen, a brand name of Advil, and chemical propionic acid, which can all be ordered in that way, and it goes in that little pink sheet. And you have to figure it out. It's very complicated. When I was in nursing school, I was taught the 5 R's of administering drugs. These include right patient, right time, right dose, right route, right drug. And you have to check these 3 times before giving it to a patient. So how does a nurse mess that up? With the drug name and the patient's name, if a nurse has 11 patients, and room 1 is patient Jake and he needs acetazolamide, and patient in room 11 who is patient Jake and he needs acetohexamide, it can get very complicated. Another main reason is the math needed to do the drug calculations. So here is an example. So a doctor ordered 503 milliliters of salt IV to infuse in 462 minutes by an infusion pump. What is the flow rate? I had to look it up too. It was 65.3 milliliters an hour. If you ask any medical student what is the biggest fear of getting out of the school, they would respond with making an error, getting sued, or going to jail, losing a license. It's a big deal. According to NCIBI's article, Medical Error Prevention, conducted on May 5th, 2019, the author Thomas Riedowitz states that the fear of punishment and losing the job is a top reason for not reporting medical errors. So, in conclusion, medical but errors are a lot more common than people think, and you need to be an advocate for your own health and question things that don't make sense. If somebody's ordering you 2.5 grams of something, of like an opioid, and you need 0.25, you can ask the nurse, hey, this doesn't look right, and I'm sure that they won't mind or anything. They'd rather look after you than, yeah, so yeah. Cool. Any questions? Nope.
Nope.
Cool. So I think you need to go through again. And that's it.